So, good afternoon, all, and thank you for your participation. Today, with great enthusiasm, we present this our 16th webinar in our ongoing knowledge sharing platform. So, with a great pride, we are sharing this webinar today along with Dr. Vikas. So, Dr. Vikas is a freelance layer consultant having 16 years of experience in handling poultry farms, their management, and giving solution to the farmers. So, Dr. Chaurasia supports layer and broiler farmers, feed millers, and pharmaceutical companies by providing solution in farm management, least cost feed formulation, disease control, and sustainable production practices. So widely respected for his leadership and mentoring skills, he has trained and guided numerous veterinary professionals now serving across India. So I welcome Dr. Vikas on this platform for sharing insights on prevention and control of respiratory disease in poultry. Dr. Vikas, please.
Thank you, Dr. Sanjay, for the nice introduction. Thank you, Chembond team, and good afternoon, everyone. So, I am very happy to be here as a speaker. I am welcoming all the participants who is part of today's webinar. So, one important things, I am not expert of this subject, but I will try to give my best knowledge to you. So if I made any mistake during my presentation, please correct me after the finishing up my presentation. So can I share my screen? Today we will discuss about prevention and control of avian respiratory disease. So 1 minute, Dr. Sanjay, how can we this minimize? Yes, right now. So today agenda of our meeting, brief discussion about respiratory disease identification, treatment and prevention, vaccine and vaccine methodology, immunity boosting, and take home message. So, what is the farmer demand now? If I am talking about breeder farmer, they want more sellable chicks. And if I am talking about layer farmer, they want more hen house egg. Like a broiler farmer wants low FCR as much as possible. So if you want to maximum performance from bird, we have to update about new genetic potential of bird and new innovation. Previously, layer bird was produced 320 egg in 72 week, but now layer bird is giving close to 480 eggs in 100 week. It is because of new genetics. So in next 28 week, bird is producing 160 more egg. So for this genetic potential, if you want to achieve, you have to focus on body weight, immunity, respiratory health, and gut health. Why body weight is important? Because it's a indicate of sexual maturity and overall development of all the organ on right time. Immunity. Why immunity is important? Because of production of antibody and proper vaccine titer enhancement. Respiratory health and gut health. Also, it is a part of immunity because respiratory gut lining having a vault means bronchus associated lymphoid organ and gut include a galt means gut associated lymphoid organs. So both are responsible for antibody production and maturation of the antibody. So it is very important why birds gets more frequent respiratory infection or more frequent viral infection. Birds have a complex and highly efficient respiratory system adapted for flight, which include not only lungs but also 9 translucent air sacs extended up to abdomen. This system facilitates unidirectional airflow and high oxygen exchange. So, unlike of human body, human lungs, one don't have diaphragm. So, means that inhaled pathogen or toxin can quickly spread throughout the entire body and making systemic infection and complication like ear So, and again, that is the reason the ear sac have poor blood supply and local immune defense. The delicate epithelium lining of the respiratory tract can be easily damaged or paralyzed by irritants like ammonia, dust, or viral infection. So, the factor affecting respiratory tract, viral and bacterial disease like ND, IV, AI, ILT, coryza, and mycoplasma infection. This all disease impact the poultry respiratory tract, basically destroyed epithelium blide and mucus secreting gland. Symptom like inflammation, congestion, and potential leading to secondary infection, respiratory distress, and even death. So, what are the most common respiratory disease of poultry? So, HPAI. Most prevalent strain is H5N1, also called as bird flu. So, nowadays, most of the part in India facing a HP problem because there is no legal vaccination available because of some government rules and regulations. So we are unable to control this disease because of there is no proper vaccine is available in India. Second is LPI, low pathogenic avian influenza. Most prevalent strain is H9N2 variant strain, also called as variant or BVND. Now government gives some company for the approval of production of vaccine against the LPAI. So now against LPI vaccine is available. Then Ranicate disease, also called as Newcastle disease. So most pathogenic and prevalent strain is genotype 13 and genotype 7. Fourth one is infectious bronchitis. So Ranicate disease and infectious bronchitis disease is more common in the field. The infectious laryngotracheitis. This disease is not common in North India, but South India, most of the mortality because of ILT in laying mortality and growing mortality. Nowadays, people are discussing about avian metapneumovirus, also known as swollen head syndrome. So breeder is already doing vaccination against this disease, but some of layer farmer doing vaccination against this metapneumovirus. But in future, we have to think about the vaccination regarding avian metapneumovirus. The symptom of avian metapneumovirus, just like a mycoplasma, jelly septicum infection, and coryza. So, differential diagnosis is also very important. So, these are all viral disease. So, viral disease is highly pathogenic as compared to bacterial disease because we cannot treat with antibiotic like bacterial disease. So, in bacterial respiratory disease, mycoplasmosis, MG and MS infection, basically respiratory disease is chronic respiratory disease, and second is infectious coryza. So, between 2006 and 2019, Global Animal Health present one data which shows top 10 highly pathogenic disease. That 10 disease is highly important for the economic loss in poultry. So first is major disease is HPAI, high pathogenic avian influenza. Sorry. Then infectious bronchitis, LPAI, ND, IBD, mycoplasmosis, pleurum disease, fowl cholera, fowl typhoid, and duck virus hepatitis. So the severity of infection depend upon strain of virus. If virus is highly pathogenic, that cause high mortality in the flock as compared to low pathogenic virus. Amount of virus means even if low pathogenic virus ingested by bird in high amount, so symptom shows like a high pathogenic virus. Age of bird. If infection comes in early stage, it causes high mortality in chicks. Weather and housing condition. If ventilation is poor and high quantity of ammonia and less gaseous exchange, it causes a major impact on bird health. One important thing, why early immunization is needed. Up to 3 weeks of age, bird immune system gets underdeveloped, and the day-old chicks don't receive sufficient quantity of maternal antibody from parent, forget about protection. So major diseases ND and IV frequently comes in poultry. So in both the cases, early vaccination is very important to protect bird from these virus. Predisposing factor and reason of viral outbreak. Immunosuppression agent like IBD, CAB, and mycotoxin. That causative agent attack on immune system and very hard to produce immunity. So they cause immunosuppression. Once immunosuppression impact the bird, it failed to produce antibody. Disease like CRD and coryza, it disturbed the mucosal and epithelium lining of the trachea and bronchi. High ammonia level and poor ventilation. In winter, outbreak is more common because of the ammonia level is high. Basically, in North India, ammonia is very high because of the close packing of shed. In South India, it is not common. So the fourth one is poor nutrition. Nowadays, everybody is using more unconventional source and imbalance of protein and amino acid profile. Poor vaccine titer due to wrong method of vaccination and poor immunity of bird. One interesting thing, live IVD vaccine itself cause immunosuppression and particularly intermediate plus vaccine, also known as a hot vaccine. Somehow it is also aggravate CAB problem in many cases. So today we'll discuss about three respiratory disease. First is mycoplasmosis, second is infectious bronchitis, third one is Newcastle disease. So mycoplasmosis, MG and MS infection, CRD, chronic respiratory disease caused by Mycoplasma jelly-septicum. CCRD means complex chronic respiratory disease. When it comes with other pathogen like E. coli and other environmental factor causing very high mortality. If you are find swelling in joint and lameness, it is caused by Mycoplasma synovium. Transmission is very important in Mycoplasma infection because Mycoplasma is vertical transmitted disease. Means this disease is transferred from breeder to offspring. So always in case of Mycoplasma, breeder health is also important, and in breeder, whether they are doing vaccination or they are doing Mycoplasma prevention program or not following, depend upon the chicks quality. Horizontal transmission, it is spread through direct contact, airborne, dust and droplets or contaminated equipment and water. So what is the key features? If your flock is affected with Mycoplasma, so you cannot achieve body weight on time, right time. Delayed sexual maturity. You cannot achieve sexual maturity on time. Never achieve peak production. You can find more egg breakage, and this breakage due to Mycoplasma synovium. Interfere in vaccine titer. invitation for other respiratory problem like ND and IB. So Mycoplasma affected flock produce 15 to 35 less hen-housed egg during single layer cycle, depend upon the severity of infection and duration. So you can see the economic impact if you are getting less egg. Suppose nowadays egg price is approximately 6 rupees. If you are getting 15 less egg, so cost around 90 rupees per bird. You are losing 90 rupees bird because of this mycoplasma infection. If you are getting 35 less egg, so you are losing 210 rupees per bird. It is again depend upon the severity of mycoplasma infection. So if you want to save this money, you have to either vaccinate the flock or either proper treatment by prevention of mycoplasma drug. So symptom, eye and nasal discharge, eye discharge, watery eyes and facial swelling around the eyes or sinuses. When you got swelling in joint because of mycoplasma synovium, one important sign we can see in flock the egg apex abnormality. This is some picture, upper picture like this. It's showing mycoplasma jelly-septicum infection, also called as chronic respiratory disease. And lower picture, it is complex.
You make it in larger view.
Okay.
Just go there. Slideshow, in slideshow.
Okay.
Yeah. Continue, sir, please.
Sorry for interruption. So this picture is showing egg apex abnormalities, also known as glass top egg. So when IV infected flock produce egg, so one end of egg is little bit rough surface and little bit thin shell of egg like this. This is exactly mycoplasma synovium infected egg. So if you are seeing in your flock this type of egg, immediately you can treat with the mycoplasma treatment. Then two picture is showing normal ear sac and cloudy ear sac. This is non-mycoplasma infected flock and this hazy and cloudy ear sac because of mycoplasma jelly-septicum infection. So treatment and prevention. So number of drug for the treatment of mycoplasma infection like Barocin, levofloxacin or sulfa drug, but drug of choice is tylosin, tiamolene, tilmycin and tilvalucin. Tylosin is old drug, now resistance developed against the tylosin. Timolene don't use along with the anticoccidial like monensin and selinomycin because it gives symptom like lameness in bird if used with anticoccidial drug. Tilmycin. Tilmycin is very good to treat this mycoplasma infection, but don't use in laying period and layer because it cause bitterness in egg. If you are selling table egg and customer is raising the problem of bitterness in egg, tilvalucin, it is very good drug. You can use in breeder, layer and broiler. Vaccination. Live and killed both vaccination are available. Now latest live vector vaccine is also available and very effective because of this long lasting immunity. Second disease is infectious bronchitis. It is caused by gamma coronavirus. It is single stranded envelope RNA virus. It is the most contagious viral respiratory disease in poultry. And in non-vaccinated bird, it spread easily. Transmission, there is no vertical transmission, so breeder cannot transfer this disease to their offspring. Same horizontal transfer, same like mycoplasma infection. Symptom, it's affect almost all the vital organ of birds. When it affects on respiratory form, soil and head, tracheitis, yes, sacculitis, and peritonitis. If it infects reproductive organ, they produce symptom like production drop, axial abnormality, thin albumin, cystic oviduct, and penguin gait. Nephropathogenic form, it cause visceral gout, nephritis, and urolithiasis. Gastrointestinal form, less prominent, but it disturbs the gut microflora. So pathogenesis of bronchitis, it divided in two parts. Once viral effect in between 1 to 3 week if age means rearing period is symptom like gasping in chicks causing high mortality, tracheal plug, and visceral gout. Then, if viruses infect between 18 to 19 week of age, it shows symptom like egg production drop, axial abnormality, watery albumin, and mild symptom of respiratory shine. What one important things? If virus infect in early stage of life between 1 to 3 week of age, and this virus is variant type or QX type, so it shows symptom in laying stage because they produce false layer. So 10% to 20% is non-layer bird. If early infection is come in your flock, and when bird is coming to production in laying phase, and you are seeing my production is not going beyond the 80% plus, so it is a case of IBQX. Simple. Pathogenesis of IBV virus. This virus affect different part of oviduct and ovary. So on the basis of affected part, oviduct shows different type of outcomes result. When it's affect in ovary, so it shows symptom like ovarian regression. When it affects on infundibulum, symptom shows like fails to catch yolk. When it affects magnum part, egg is showing watery albumin. When it affects isthmus part, misshapen egg is produced. When it affects uterus, axial gland, or vagina cuticle, so majority of cell defect is coming from this type of infection. This picture is showing when bird is infected with early stage gasping. It is a typical symptom of IV case. Upright, open mouth breathing, bird is showing. Here, uterus is showing gout. Here, inflamed kidney, deposition of calcium carbonate deposits. And this last picture is typically pathognomic lesion. It's showing junction of trachea and bronchus, plug-like cheesy material. So that is the reason bird showing gasping like symptom. This is a typical posture infected bird infected with IBQX infection. It also known as penguin gait. This is two reason. One is reason is IBQX and second reason is ascites. Once open the bird, if butter in pouch, it is a IBQX, and other case, if abdominal cavity having a fluid without pouch, it is a case of ascites. This different type of egg pictures infected with IB cases, like small and different size of egg is coming in IV infected flock. This breakage is coming in infectious bronchitis cell-less egg. And the main feature is when you are breaking the egg and pour on plate disc, the thick and thin albumin, there is no demarcation. So you can say it is IV infection. When egg passes with the light, so this type of porosity is showing So it is again either because of two reasons, either calcium deficiency or case of IB. Once if you treated with calcium tonic and you are not getting any result, so definitely it is a case of IV infection. This wrinkled egg is also coming in IV infection. This is typically mango shaped egg. It is coming in only in case of where bird is affected with Newcastle disease. So treatment and prevention. There is no viral treatment. We can give antibiotic only because of secondary bacterial infection. Vaccination, live vaccine and killed vaccine both are available. In live vaccine, classical and variant vaccine. In classical form, H120, MA5, M41 is available. Variant type 793 by B, 491, 1Y96, IB 88. Some other variant strain also available. But more important part, technique is very important to prevent IV infection. Mass type vaccine alone don't protect IV infection. Same variant type vaccine alone don't protect IV infection. For good protection of IV, always use to combination of mass plus variant vaccine. This is the example. Suppose if you are doing first vaccination mass type and field virus is mass type, so you can protect your bird. But in second case, if you are doing first vaccine mass type and field virus is variant type, there is no protection. In second example, if you are doing first vaccination variant and the field virus is mass type, classical type, so there is no protection. Second case, if you are doing variant type vaccine and field virus is also a variant type, then you got protection. Oh, sorry, one slide I'm missing. And the third example is if your first vaccine is mass type and second vaccine is if you are doing variant type. So both type of vaccine, if you are doing, if you got good protection, then you did first vaccine mass type, second vaccine variant type, and field virus is mass type, then you got protection. First vaccine mass type, second vaccine variant type, and field virus is variant type, again you got protection. So second vaccine can be combined with first vaccine to cover the opportunity of window at a day of age. Either you can mix with both vaccine or either you can give separately. No problem. Third disease is Newcastle disease caused by avian paramyxo type 1 virus. Transmission like IV infection, there is no vertical transmission, hen to chicks. If breeder with low maternal antibody, chicks can get infected at early age. In this case, early vaccination is very important because ND and IV is most common disease in poultry. Horizontal transmission is aerosol route, contaminated feces, litter, and fomites. What is the clinical symptom? ND affected flock shows open mouth breathing, nervous sign like tremor, birds moving in circular motion, twisted neck, and paralysis. If you are observe litter, greenish diarrhea is observed. Mortality is very variable, up to 100% mortality in virulent Newcastle disease, like if your flock is affected with genotype 13 or genotype 7. In layer flocks, production drop up to 50% or even more. Target organ. Like IB virus, it also affects almost all the vital organ of bird. When it affects nervous system, symptom shows like tremor and neck twisting. When it affects respiratory system, hemorrhagic tracheitis is observed. When it affects on gastrointestinal system, The pinpoint hemorrhage in proventriculus, it is a pathognomic lesion of ND or RD. And other symptom is cecal tonsil. When it affect on reproductive system, a small egg and typically mango-shaped egg, it produced by the bird. These are some pictures showing ND infected flock. This is neck twisting. This is shaking of head, and this is greenish diarrhea and typically mango-shaped egg. Treatment, there is no treatment. Again, it is a viral disease. We can only prevention of the disease. Different type of vaccination are available in live attenuated vaccine, lantogenic, Hitchner, B1, Lasota, etc. In mesogenic, Roycan and Mukteswar strain is available. Inactivated vaccine is also available. Nowadays, recombinant HBT based vaccine are also available and giving a good protection for longer duration of time. So, very important part, how to prevent that respiratory disease. Vaccine and vaccination failure. Almost all the farmer doing mistake here. Everyone is doing good vaccine and vaccine company, good vaccinator, good amount, but they are forget some silly or small point like cooling chain failure at medical shop or during transportation. Nobody is bothered about, nobody is checking medical shop. They are maintaining proper cooling temperature. During transportation, nobody is bothered about, nobody is receiving time checking whether it is properly cooling chain maintained or not. So in case of live and killed vaccine, storage temperature is plus 2 degree to plus 8 degree. Always we have to follow this temperature for the proper working of vaccine. Live vaccine, in case of diluent storage, outside of the fridge, but before vaccination, it should be storage at fridge. Before vaccination, declination of the water is very important. Killed vaccine, vaccine bottle temperature getting down to room temperature and then inject. So in viral killed vaccine, shake vaccine bottle at 30-degree water temperature for 10 minutes before injecting. On other hand, bacterial killed vaccine, shake vaccine bottle at 35-degree water temperature for 10 minutes, then inject for the full protection and less vaccination reaction. Third point is missing of bird. We are doing vaccination sometime we are doing very fast vaccination and missing the bird. Always checks vaccinator, it is releasing proper dose or not releasing proper dose. This is the normal vaccination schedule what we are following in North India. So first vaccine on day one, we are doing IV Lasota by spray method or we can do eye drop method. Second, first vaccine on day old chicks is MD vaccine. Fifth day ND concentrate. Then after that in 9th or 10th day, we are doing DV King. 12th or 13th day, we are doing IVD vaccine. It is an intermediate plus. In 20th day, now LP legal vaccine is available. So we are doing in LP vaccination. 24th day, we are doing IVD vaccination. And 5th week, we are doing pigeon pox. 32 is again, we are giving IB and Lasota. 35 days, ND plus Coryza. Maybe you are give along with the ND plus Coryza or you can give separately. 45 days, again LP vaccine. 60th day, again IB and Lasota. 65 days, Coryza. 80 days, R2B plus Foulpox. 90 days, again IB and Lasota. In 100 days, LP and 110 days ND plus IV. Always should be remember all the vaccination should be finished before egg laying start. And this is schedule what we are following in North India. You can change as per the field condition. So ammonia in said it is very important to prevent ammonia because it is the main culprit of inviting a viral disease. When ammonia level should be less than 25 ppm. Human nose detect ammonia level at around 20 ppm. Suppose at 50 ppm, start damage of ciliary lining, depressed growth rate by 4 to 8%, reduced appetite of bird. At 7 to 5 to 100 ppm, hemorrhage in trachea, drop in egg production start. Sometimes it's create a problem like a symptom showing like a viral infection, but it is the case of this high ammonia concentration in the shed. More than 100 ppm, ammonia blindness, affected bird keep their eye closed. It is also very important biofilm in the pipeline. Biofilm in the pipeline main harbor of many bacteria and food for the bacteria. And it is also when we are doing any drug in the water, it is create bacterial drug resistance. And if your pipeline is having biofilm evergreen E. coli problem in the your farm, you cannot treat bird with the antibiotic. First, you have to treat with your pipeline to reduce the biofilm. Prevention of mycoplasma. Prevention is very important because itself it is a very harmful and invite number of other respiratory disease. So immunity boosting. Feed rich in amino acid, vitamin E and selenium. It is anti-stressor and enhance immunity. Nowadays, very common is farmer is using moss, menon oligosaccharide and beta glucan. It support immune response. Phytogenic ingredient very good. Ginger, garlic, and turmeric is very good for winter prevention of disease. It is act as a natural anti-inflammatory and antibiotic activity. For prevention of viral, lauric acid and alpha monolaurin is very good. When you comes in outbreak, if you use lauric acid or alpha monolaurin, it gives a lot of very good result. Vitamin C, antiviral and anti-stressor. Vitamin C is also very good effect on antiviral activity. Probiotics maintain balance gut microflora. So last is take home message. Prevention is better than cure. Maintain strict biosecurity. Use vaccine correctly. Right dose, right temperature and based on local challenge. Stay update about the latest vaccine. Provide regular training to manager and labor. Ensure a balanced nutritional diet. Prioritize respiratory and gut health, healthy gut microflora. Minimize ammonia and CO2 level in the shed with proper ventilation. Thank you very much.
Thank you, sir. I just also thanks to all the participants, and I request them please kindly share your question in chat box. So after 5 minutes, we'll read out, and Dr. Vikas will answer your questions. So I'm giving 5 minutes window to all of you. So share your questions in chat box. Sir, my voice is audible to you.
Yes, yes.
So there are a few questions we received from the participants.
Okay.
So just one by one, I'll read out. How to differentiate subclinical VVND and IB? One of the participant, Dr. PSR, he asked.
Okay. Okay. So subclinical VVND and
IB.
subclinical IV. Yes. It is basic difference we can see in tracheitis. Suppose in case of BVND, the cheesy material can found in everywhere, like whole trachea. But in case of IV, you can found plug in only bronchial junction where trachea bifurcate to the bronchus. So it is a pathognomic lesion of this IB. And second, if you observe like gasping or breathing activity, so in case of this variant, there is no stretching of neck. And in case of IV, bird stretch neck upright and there shows breathing difficulty. So these two are major differentiation.
Sir, sir, one question is there from the farmer. In IB case, one layer farmer using plain IB killed at 12th week with strain of Astro and QX strain. So it's sufficient and good. The birds it is sufficient and good for birds.
No, if you want to protection against QX strain, so you have to go little earlier. Better is giving day one variant strain with the live IB plus Lasota along with, and later on around fifth day of age, do IV killed vaccination. It gives better protection.
Okay, sir.
Because if you are giving at the age of 12th week, you missed the prior window. So it is chance to get infected in that period.
Okay, sir. So another question is it enough just vaccinating at the grower stage
Sorry,
to
sorry,
get,
repeat again.
yeah. Is it enough just vaccinating at grower stage to get protection during the production in case of variant IBV?
Yes, it is sufficient, but more important thing, after 32 week of age in laying phase, you have to continue after around 45 or 60-day gap. Again, repeat this IV live. But in variant vaccine is not needed in laying phase.
So in the case of day one vaccination of IB plus Lasota,
Hmm.
can it interfere with maternal antibodies,
No, no,
particularly for
there is
AMD?
no. There is no interference with maternal antibody. This maternal antibody interfere only in case of IVD vaccine, and there is no other disease vaccination. There is no problem. You can do in day one. Everybody is practicing now day one only because they don't want to miss a window for the affecting this virulent virus. That is the reason.
Okay. So, sir, some people are, they are asking that rejection in terms of misshapen eggs and
Mhm.
which is behind the standard. And from the misshaped eggs, about 40% watery albumin after getting this condition in some flocks. They have vaccinated the other flock, which were okay with IB, MA5. Then with IB variant SIVA vaccine, still those flocks also got affected. By sequencing, we get to know that was 793B type. What is your thought on this? Him
Mm,
is uh,
got your point, Dr. Saab. Actually, in this case, vaccine, again, as I mentioned in my presentation, proper vaccination you are doing or not, it is very important. And main important thing, you are following prevention program of mycoplasma or not. Because in winter season, who is asking this question asked to if they are facing problem in mostly in winter season. Why? Because once this ammonia level high and they are not giving proper ventilation, so ammonia level is high and CO2 level is high, and there is a less space for oxygen. So this region, it damages the epithelium lining of trachea. Once epithelium lining disturbed, virus can easily invade the trachea and attach the tracheal lining, and there they maturate and enter into the bloodstream and travel to the target organ. So if you want to protect this type of situation, so you have to focus on mycoplasma prevention program and vaccination, and you have to check freezing storage temperature of vaccine, and who your labor is injecting this vaccination, you have to check either they are doing properly or missing the word. It is not common, but you have to, once you checked that all the checkpoint.
Thank you. Sir, the last question is, in multi-age farms, what is the most practical control approach for mycoplasma?
Mm, Mycoplasma, actually, vaccination is for layer world is very costly. So you can do one thing. You have to follow mycoplasma prevention program from day one. Once all flock comes to the mycoplasma prevention program, definitely you can get rid of this problem. Up to when you are one flock, then second flock, then third flock. After that, your problem will be automatically sort out, and you will see the difference. You will get more body weight above the standard, or just what is the standard, and you will see early maturity in the flock and good production, peak persistency, good quality of egg.
Thank you. And I just want to share my vote of thanks to you, sir.
Thank
On
you
behalf
very
of
much.
the Chembond Biosciences, I extend my sincere thanks to you, sir, and thank you for this insightful and highly practical session. The clarity with which you shared on field-oriented insights on poultry management and disease control will definitely help to farmers and industry professionals to improve productivity and sustainability. We are also grateful to all the participants for their active involvement and thoughtful questions and continued support. So this session marks another successful milestone in our ongoing knowledge sharing webinar series, and we look forward to many more such meaningful interaction in the futures. So thank you all for being a part of this learning journey. Thank you, Dr. Vikas.
Thank you very much, Dr. Sanjay and Chembond team, and thanks for the all the participant.
Thank you, sir. And this webinar very soon is available on YouTube. So shortly we'll share you the link, sir.
Thank you.